So my book's about an inflammation nation, and today we're going to talk about certain things that trigger inflammation. Once you understand inflammation, you'll understand how to improve all your health functions. Because inflammation now is what we understand is a triggering mechanism that makes every disease worse. Okay? Now there's three things that I like to talk about. In my book I have 10 steps, but there's three main things. If you understand inflammation, if you understand your immune system, and if you understand your microbiome, which is your GI tract and your gut, where all science is moving now today, is that almost every disease can be reversed, prevented, or treated naturally. So inflammation is now understood to be one of the triggering mechanisms that make almost every disease worse. So A to Z, if you look from head to toe, from cardiovascular, pulmonary, cancer, diabetes, you name it, everything has an inflammatory aspect. And think of inflammation as being the fire within the body. That's just a simple way to think about it. Okay? And with this fire within the body is we have two aspects. It's like a yin and a yang effect, or the Goldilocks rule. You don't want to have too much, you don't want to have too little. And the root word of inflammation just comes from the root word flam or fire, or itis, I-T-I-S. So anytime you hear the word itis, and there's a word before it, that just means inflammation of that area. Now, the problem is, for example, here, we need a little bit of inflammation. I show a picture of your kitchen, I show a picture here of your living room and your bed. You need to keep a certain amount of temperature, right, to keep your house warm, to cook your food appropriately, but you don't want to have a kitchen fire. You don't want your bed on fire or your house on fire. Now, when we look at inflammation, inflammation then leads to chronic disease. So acute inflammation usually is a good thing. If you have a fever, for example, your immune system says, hey, there's a virus, a bacteria, I have a cancer cell in my body, I'm going to evoke an attack, I'm raising my blood temperature, because those three things, viruses, bacteria, fungi, and cancer cells, do not like high temperatures. That's why we spike this kind of fighting response. The problem is if that fever is lasting too long, maybe 7 days, 10 days, that means our immune system wasn't strong enough to complete its job, right? Then we get some kind of infection, and that needs to be treated. But the chronic inflammation is a problem. If the chronic inflammation is there continuously, then we have degeneration and we have diseases, is what we call it in the Western world. So when we look at a knee, for example, there's a picture of a knee here, chronic inflammation to your knee, then we call it arthritis. There's a picture of a colon there, and chronic inflammation, we call it colitis. Heart disease, I don't know if you can see over here, but you see those four vessels, that just shows you your cardiac vessels. And as we see is that with inflammation, with C-reactive protein and a variety of other inflammatory markers that doctors and cardiologists can order, is that as that inflammation goes up, then cholesterol only comes from animal proteins, tends to stick, right? Then we have heart disease, right? Number 2 killer right now in the United States is heart disease. Every 20 seconds right now, so 3 people a minute right now is having a heart attack in the United States, and 3 jumbo jets full of people will die every day from heart disease, yet there's no war on heart disease. Okay? So that's a chronic inflammatory response. And then when you look at people's brains, we look at dementia, which is a big problem now in the United States, and moving forward in the world population. Alzheimer's, Parkinson's disease, these are all chronic inflammatory diseases in the brain over decades. And that chronic inflammation then causes different types of protein plaques, beta amyloid, tau proteins, a variety of other factors that will then disrupt how the neurons function. So when people go, oh, my grandmother was really confused and they took her to UNM hospital and they scanned and they see these plaques on her brain. But that didn't happen just the day before. That's something that's been set up over decades of chronic inflammation. But then we have to ask, well, where's this inflammation coming from? Now, we have over 200 different itises, and that's the problem. No one's looking at what's the underlying cause of these itises. So let me give you an example. Red eyes or allergy eyes, we call it conjunctivitis. You get runny nose, we call it rhinitis. We all have had sinusitis, ear infections, otitis. A lot of people right now have a little laryngitis. You can hear my voice is a little bit hoarse. People can get pharyngitis, sore throat, bronchitis of the lungs, right? We get kind of reflux, we call it esophagitis. People can get gastritis, colitis. Women can get vaginitis. Men can get prostatitis. We all can get arthritis, right? Dermatitis. The problem is conventionally is we end up treating the symptoms, right? So eye drops, nasal spray, oral pills, inhalers, upper pill, lower pill, topical salve. They all work, right? So you can take an antihistamine, you can take a steroid, you can take your inhaler, you can take a pain pill, but they only work temporarily. And even when you take natural medications, right? Natural supplements, natural anti-inflammatories, they do work. They're safer, The problem is as soon as you stop taking them, right, you still flare. So the goal is, in our practice, we always look at, can we move people to safer, more natural treatments, but more importantly, can we find the underlying triggering mechanism of what's causing them to flare to begin with? Otherwise, we're just prescribing green pharmacy. So now, chronic inflammation over time also is the pathway to cancer. So we now know that, for example, patients that have Crohn's disease or colitis problems, in about 30 years, almost half of them will have colon cancer. Rheumatoid arthritis, patients with active rheumatoid arthritis in 10 years will have a 71-fold time more increase of having lymphoma. I just saw one 2 months ago, a patient, classic, 12 years, active rheumatoid arthritis, now she has lymphoma. And she's like, why do I have this now? I go, because you've been on fire for 10 years, 12 years. Okay? The body can't keep repairing itself, fighting, fixing, and repairing. So then chronicity of diseases get worse, and overall the immune system is failing at doing its job. So what we like to focus on, and today we're going to talk about, is what can you control, okay? And cancer and chronic disease, and this is actually from MD Anderson's slide in their data, is that 97% of disease, chronic diseases and cancer are preventable, okay? Now everybody wants to focus on the small little bar on the far left here, which is called genetics, but that's not where we need to be focusing. And in fact, the new data in my book, which we talk about, is 3%. So 3% of all diseases are genetically related. 97% of all diseases are not genetically related. It's called epigenetics. What epigenetics is your diet, your lifestyle, your belief system, and your environment. This is what shapes your DNA and RNA to transcribe in real time. So when we used to think, oh, heart disease is running through our family, and diabetes is running through my family, and oh, my grandfather had a heart attack, my dad had a heart attack, I might have a heart attack, but it wasn't a gene that was being passed down. It was more like the cheeseburger, the smoking, the stress, and the environment, right? And we didn't know that. So a lot of times, like, oh, my uncle's a diabetic, my brother's diabetic, so I'm just going to go to Krispy Kreme and not worry about it because I'm going to be diabetic. And that's kind of what it's happening, is that epigenetics is that we actually are growing the disease. We used to think that the genes were cards. You got the heart disease gene, you got the breast cancer gene, you got this kind of gene. It's not true anymore. We all carry the cards. It's how you play the game. Okay? And that's the difference, is because we control, our genes don't control our destiny. We control our genes and how they express through diet and lifestyle. Okay? So we can, and my book will cover all the data on that. Now, of these lifestyle factors, as you can see, if you stop smoking, 30% reduction. So that's why we always tell people to stop smoking. 35%, the largest contributing factor right now is diet. Okay, in America, it's the worst thing. The standard American diet, we call it the SAD diet now. Now, when we look at obesity, right, so 70% now of Americans are overweight or obese, or like our POTUS in Washington kind of grew an inch so that it wouldn't be BMI so high, but that's questionable. But the obesity puts people at risk. Okay, it's a pro-inflammatory state for diabetes, heart disease, and other things. Infections, so chronic infections is just a marker of people having low immune system functioning. We know that chronic infections over time increase inflammatory states, and also environmental pollutions and toxins. So that's why we want to be eating more organic foods. Thank you for Natural Grocers for sponsoring some of the foods and whatnot here. More organic, less chemicals in our body. Okay, so all these things that we can control, that's what we should be focusing on a daily basis, not worrying about genetics. Now, inflammation, since we're all from New Mexico, the way I say it is like your body's a flat New Mexico roof, okay? Don't ask me why we have flat roofs, that's just the way it is, okay? If you can find out why we have flat roofs, I'll be really interested to know. So think of rain being inflammation, and this inflammation goes onto the roof, and if it doesn't drain, all it looks for is the weakest link, okay? And that's where inflammation goes to each and everybody's body, the weakest spots, okay? Now, we all have different roof contractors, and therefore, and in New Mexico, half of them are probably not licensed. So, so that's why every 5 to 7 years we're fixing our roofs, right? But where it goes in everybody, so some people, oh, I have skin problems, oh, I got knee problems, I got colon problems. It doesn't matter, we don't care where it goes. What we're looking at for, what is the rain that's coming down, okay? So if you have a trauma in your body, it's the first place it likes to go. If you have a trauma in the body, say you hurt your knee, or you got in a car accident 20 years ago, or you played football in college, or you fell off a horse in Santa Fe. Last year was the year of falling off of horses in Santa Fe from patients of mine. I don't know why. But anyways, I don't know. But when people have an injury, on a cellular level, there's a little bit of inflammation. Think about like once the body heals, think of it like a kitchen pilot light. It just stays a little bit on. And anything that's pro-inflammatory in the diet, anything that's pro-inflammatory that comes into the body will like to go to that little roof leak area and then relight it up. Okay? So the interesting thing is everybody will think over time, like, oh, I have arthritis, I have degenerative disc disease, I have this and this. Why do you have it? Oh, I'm getting older, I'm aging, it's my hormones, it's the economy, it's Congress, it's the president. Probably all of them, but really it's truly getting inflammation over time. Okay? So when people say, oh, my back's hurting, I go, are you playing football today? No. Are you in the car accident today? What's wrong? I have arthritis. What does arthritis mean? It just means inflammation is going to the joint. But no one's asking what is causing that inflammation. So we just go on and say, oh, I just take my pain pill or I think I'm getting older. Okay, but we have to look at that. Now, the second place that inflammation likes to go is pathology. So think of a tree falling on your roof and it dents the roof. Every time it rains, it's got to go there. The third place it likes to go to is overuse. So if you overuse your body too much, it's a detrimental part of inflammation. Now, there's also a healthy inflammation response from exercise, right? So we're doing a lot of yoga here, which is great, which I love, I highly recommend. Exercise, cardiovascular, weight training, we love all that. And you're gonna have a little bit of soreness, a little bit of itis after because we're building metabolic tissue. That's really important. The problem is over time, as we're having more pro-inflammatory foods in our diet, then we're more sore. Right? And we're like, yeah, I don't exercise. I can't lift as much as I did 20 years ago and blah, blah, blah. Again, excuses all day long. Not understanding is that while we're having this chronic inflammatory state, it's adding fuel to a healthy inflammatory state. Right? So we kind of become a little bit more disabled over time because we're not as active, thinking that it's getting older, but it's actually getting more inflammation over time. And last place that it likes to go is places where your immune system is not paying attention. So sometimes it's like, it's just weird places. Those soldier cells, your Pac-Man cells, all the different cells, your macrophages, white cells, neutrophils, eosinophils, basophils, monocytes, all your soldiers of your military sometimes are not looking in certain places. And so there's a dysfunction of those cells regulating and circulating, fighting, fixing, and repairing. And we'll be talking a little bit later in this lecture of what you can do to help improve that. So there's a pillar of a variety of factors: smoking, solar radiation, sun radiation, alcohol. I'll talk a lot in the middle section today about the standard American diet, infections, viruses, bacteria, fungi. I think there was some lectures today talking about parasites and stuff. So these are important things. These are things that cause chronic inflammatory states. And obviously environmental pollution, and I think the biggest thing right now, aside of the diet, is the one on the far right is the stress level. Stress can cause inflammation. Right now, we're in a high amount of stress, so even if we take someone, we put them in the biosphere, and we feed them the perfect diet, and we give them all these wonderful things, if we stress them out, all their inflammatory markers in their blood go up. Okay, so we never should underestimate the power of stress. We all should look at ways to de-stress. Now, these are the 10 steps that I talk about in my book. I'm going to start with a few. First, we're going to talk about eating an organic, anti-inflammatory, plant-based diet. We'll talk about what that means. Then we're going to talk a little bit about food sensitivities and how your body can have a specific immune response, an inflammatory response to any food. We'll talk a little bit about what you can do to help reduce the inflammation, what you can do to help improve your immune system functioning, and overall just how you can improve your overall community. Now, the first question that we always get is, where do you get your protein? This is probably the #1 question I'm asked on a daily basis, okay? And the problem is most people are not understanding nutrition. Most doctors, most chiropractors, most naturopaths, doctors of oriental medicine, and most fitness trainers, most people have not had a course of nutrition. We've learned something through our training, but that's not evidence-based. Even hospital dietitians cannot really truly answer this because our evidence, our information that has been presented to us has been presented by food lobby groups. Our whole pyramid now is completely incorrect for those who've been following the pyramids, food pyramids over decades, okay? Even now it's almost turning upside down, okay? So we want to just talk real quick about what proteins are, the difference between what we consider an animal protein and a plant protein. Once you understand inflammation, end of discussion, okay? So everybody looks on social media, everybody looks on the internet, everybody talks about, oh, you need to eat this, eat that. If you understand inflammation, if you understand the immune system, and you understand the microbiome, then there's no more discussion of what's real evidence and what's really healthy and what's not. So when you look at animal proteins in general, okay, all animal proteins are pro-inflammatory. It's the high omega-6. Omega-6s are pro-inflammatory, right? People hear of omega-3s and need to take more omega-3s. We also need to be decreasing the amount of omega-6s in the diet, okay? Now, when we look at a pro-inflammatory food, then anybody that has an itis, you got to be eating less of the foods that cause itis again. Now, if you have heart disease, right, so cholesterol only comes from animal proteins. So like I said before, what is an animal protein? Animal protein is anything that has a mother or a face. So if you're looking at your food and you say, does it have a mother or a face? It has cholesterol. It is as simple as that, okay? If you're taking a statin drug, if you had a bypass, if you had a stent, that tells me that you're eating too many things that have mothers and faces. It is as simple as that. If you want something free and something simple and easy, that's all you need to do. If you say, gosh, I got to take this Lipitor, and now I've had my second stent, that means, remember, you're not controlling your diet. Okay, so you have to look at what is causing the number two cause of death in the United States is high animal protein diets. Now, animal protein is also very low and has little to no antioxidants, particularly since 97% of all food today that's animal protein is factory farmed. Okay, so that's why most people take a multivitamin. Why do we take multivitamins? Because our food is nutrient deficient. Okay, this is not the food of 100 years ago. Okay, every generation, our food changes in terms of the potency and the purity of the soil, of everything that we're getting. Even our vegetables are now a little bit less nutrient dense as they used to be. But animal proteins have little to no antioxidants. Now, there's no phytonutrients. I'll explain that in a minute. There's no fiber in there. Now, animal protein also is high in what they call heterocyclic amines. So when we grill animal protein, we're going to call it muscle tissue. That's what it actually is. When they grill it, that little char marks on there, that actually is something it's a carcinogenic amine. Okay. Now, we eventually told people, like, say, don't fry chicken because it was an oil, right, because it caused heart disease, because highly refined vegetable oils cause heart disease. It's a pro-inflammatory food, highly refined oils, right, the fried things. So we told people, don't eat fried chicken, grill it. So yes, we lowered their heart disease, and then we increased their cancer risk. Okay? So we really want to, now the interesting thing is when you look at plant proteins, this is the opposite. Plant proteins are anti-inflammatory. So you really want to be eating an anti-inflammatory diet. Do you get all your amino acids from plants? Absolutely. Do you get amino acids from animal protein? Absolutely. There's only one food that you cannot eat and survive on that is lacking all the amino acid profile, and that's gelatin. Okay, so what do we give when you come out of the hospital or surgery? Jello. Don't ask me why, okay? When people are taking gelatin broths, bone broths, right, and they're touting, oh, it's going to heal this. No, it's the only food that doesn't heal that. It doesn't have amino acids. It doesn't have phytonutrients. Doesn't have fiber. So please don't take that product. Now, when we look at cholesterol, there is no cholesterol. So that's why when you move to a plant-based diet, which we'll talk about, you can lower and really reverse your heart disease. It's super high in antioxidants, super high in phytonutrients, which I'll talk about. It's the only thing that has fiber, and the only thing that you do when you grill vegetables that you get is just warmer vegetables. Okay, so there's no heterocyclic amines. Now, when we look at inflammation, we think of something called an omega-6. And omega-6, this is just a pro-inflammatory pathway, starting from top to bottom. This will be more detailed in my book. But when at the bottom of this pathway, when people take an anti-inflammatory, say like an ibuprofen, a Motrin, a Aleve, even a natural product, that bottom level there, the step right above that is what we call arachidonic acid. And where we get arachidonic acid from is animal protein. So we're just eating way too much of that. Now, the other thing is on the top of that graph, there, when you see from the highest omega-6 is also the refined vegetable oils. So it's the cheeseburger French fry. It wasn't a cheeseburger or French fry. Is that right now, since 2012, we're eating 40 times more omega-6 foods than we did in 1950. Okay, we used to have a one-to-one relationship. We used to have a little bit beef, pork, chicken, lamb roast. It was on Sunday. It was after church. Grandma came over, and Dad got a raise. It was a holiday. It was a game day, whatever, right? And then we ate a lot of vegetables, grains, legumes, and sometimes some fish because we couldn't afford this animal protein. It was very expensive. Now we're eating a 40-to-1 ratio. Why? Because this food is cheap. Game day is every day in America. A bucket of chicken for 20 bucks goes very far in New Mexico for a family of 4. But we don't realize what that vicious cycle of inflammation that we're causing to our patients and our community and society as a whole. Now, when we think of heart disease, so animal protein has cholesterol, right? So anything that has a mother or face has cholesterol, right? Your body does produce cholesterol, so we can't have zero. So that people think, oh, is cholesterol a myth? No, cholesterol is not a myth. It's just that you shouldn't be adding more to the body's own production of its own cholesterol. Cholesterol produces and is the precursor to your hormones, for example, right? So those people who take statins Within 2 years, particularly men, we see men who are under 30 now, in 25 or so, taking a statin for 2 years, and they have low T. Why? Because it's interfering with your cholesterol metabolism. And most other patients, then like women, later on, they have problems with hormones. Even more so when we've been taking statins for a long period of time. And when the LDL from a statin gets lower than 70, we start seeing cognitive problems in patients. But interesting thing is, remember, when we're in cardiology, we give a drug, we're only looking at one area, but we're not looking at every other place. So then it's like, oh, I have a memory problem, then there's a memory pill. Oh, I have low T, there's a testosterone drug. And if you look at which companies are selling you that drug, the same drug company that sold you the statin. Okay, there's 7 drugs from statin side effects. So we want to look at that. Now, the only thing that's been shown to reverse that plaque, so once you build plaque, you can see how the artery gets more and more clogged. The only thing that's been shown in clinical cardiology in 30 years, dozens and dozens of studies have been published in conventional cardiology journals, shown by angiogram, the only thing that reverses that plaque, once it's there, is a plant-based diet. Drugs don't do that, okay? So when you take a statin will lower your lipids on your blood test. It doesn't remove what's in your vessel. And that's why everybody in this room is probably, statins are the #1 prescribed drug worldwide still today. So if I go to Machu Picchu, if I go to Japan, if I go to Bombay, if I go to Moscow, they're all taking statins. But the heart disease, stroke, and heart attack rate has remained static. Hasn't gone down. When I was a medical student, they said, when you get out of medical school and probably get to residency, Dr. Pai, heart disease will be eliminated because we've invented statins. You'll never see a heart disease patient, right? The heart hospital is not any less busy today. Okay, and most people who had a stent, who've had a heart attack, who have a bypass, they've been on these drugs, multiple regimens of these drugs for decades. Okay, so the only thing that's been shown to actually completely reverse, now we can reverse that coronary plaque within 6 months via angiogram diagnosis. Okay, so we have people that we can take 5 vessels of the heart disease on a heart transplant list and put them on a plant-based site completely, 5 vessel disease, all will completely clear off heart transplant. We do this all the time. Okay, so and people say, oh, what do I got to do? I'm so sick. It's like, no, you just change your diet. Within 6 months, we can help you get better. Now, phytonutrients. So animal protein has no phytonutrients, phyto meaning plants, right? So anything that you see in any of these products probably out here, or any product in a health food store, comes from a plant. So you think of all your antioxidants, think of phytonutrients. So think of like your beta-carotenes and your carotenoids and your xanthines and your luteins and your lycopenes and your sulforaphanes and your resveratrols and your curcumins. All those things come from plants. There's not a single beef pill, chicken pill, pork pill, egg pill. And the fish pill, believe it or not, is the fatty acid of the omega-3 of the fatty acid oil. It's not the fish protein. So we got to kind of take that in, because a lot of times we all rush to the health food store. We're buying all these supplements, but we're really not eating the foods that those supplements are really coming from. All right? So antioxidants and phytonutrients. So again, animal protein has none of this. There's no study that will show eating an animal protein that will prevent, reverse, or treat a disease. So there's no study saying eating chicken or beef or something will reverse your heart disease, dementia, your colon cancer, your breast cancer, your Alzheimer's disease. So we have to really start thinking about that, because we eat these things every day, and then we're running to the doctor saying, oh, I got to take a pill. And then we say, I don't want to take that pill. I don't want to have the side effect. So I run to the Whole Foods or my alternative practitioner and take supplements. But we have to look at what's the core fuel that you're feeding the body that's causing this dysfunction. Fiber. So animal protein does not have fiber. What is fiber? Fiber is super important. Why? Because fiber feeds your gut. Fiber feeds your prebiotics and also feeds the probiotics. It is a prebiotic in nature. So anything that's a plant has fiber. Anything that's an animal protein has no fiber. So if you had bacon and eggs, sausage, ham, and a piece of white toast that I used to have at Denny's when I was a kid, right, that had 0 fiber in that meal. Okay? So what happens when you go to the health food store, you see Metamucil, Benefiber, Miralax, all this stuff. Why? It's because the average person's having a bowel movement every 3 to 5 days in America now. Okay? And that's a big problem, because we need to be detoxifying and getting rid of all this pro-inflammatory waste. Now, what happens is the average person's taking about 7 to 12 grams of fiber a day. And so if you look at everything goes to the liver. The liver is the organ that detoxifies. And as it excretes, it binds those toxins, xenoestrogens, hormones, and other kind of chemicals in our environment. It binds to fiber, and then we excrete it. But the average American having 7 to 12 grams is not enough. You need to be having about 35 to 40 grams of fiber a day. If you don't, it's called enterohepatic circulation. These things recycle over and over and over again. So colon cancer, number 3. Why? Because anything that's pro-inflammatory in our diet, on top of the environmental toxins, gets stuck in the body and it doesn't leave. Right? So one of the best things to do is by eating plants. Now, I don't recommend fiber supplements because if you take a fiber supplement, you're not getting the protein, you're not getting the antioxidants or the phytonutrients. You're kind of like, it's a waste of time. You should be eating more vegetables and fruits. Bad fats and good fats. A lot of people think eat more fat. Yeah, you can increase some fat in the diet, but it needs to be plant-based. Otherwise, it's pro-inflammatory fat. People who put a stick of butter in their coffee or bulletproofing is actually a bullet to their brain or bullet to their head. And we see that all the time. And in fact, I have a patient who's 28 years old who came in, was doing a bullet plan book for 9 months, lost 150 pounds on a paleo ketogenic diet. He's coming in, he's shredded, all looked really good. He's stage 4 colon cancer with Mets. 28. Pro-inflammatory diet. So all you have to understand is inflammation. Now, why people want to eat more paleo ketogenic is because they want to get away from the highly refined carbohydrates. You shouldn't be eating foot-long Subway sandwiches. You shouldn't be eating all-you-can-eat breadsticks and stuff like that. That's not real food. But you need to be eating whole grains. Complex carbohydrates are important. The problem is in America, most of the food that we get exposed to is simple carbohydrates. So everybody said, well, don't eat a carb. They weren't defining what carbs you should be getting or not. Okay? So that's a big problem in America because everybody was moving towards this paleo ketogenic diet. Now, when we look at the data, looking at 125,000 patients just recently published, for 30 years, we looked at the standard American diet. Standard American diet is like not the thing to compare anything to, right? Because every 20 seconds, someone is having a heart attack in America. But for those people who ate a paleo ketogenic diet, it increased their morbidity and mortality 24%. So on top of every 20 seconds someone having a heart attack, you're now increasing it 24% times more that you're going to have a worse outcome, cancer, heart disease, stroke, other types of morbidity and mortality things. If you went plant-based, it was 28% lower than the standard American diet. Okay? So you really want to look at what's the evidence, not what people are saying. For those people who have cancer or are interested in saying, well, isn't cancer a metabolic disease? Yes. Does cancer cells have 10 times more insulin receptors than the normal cells? Yes. Does sugar uptake into cancer cells at a higher rate than a normal cell? Yes. Right? So lowering the sugar from the diet was good. But fruits are okay. You can have fruits. We just want to cut down the highly refined, sugary foods. But the interesting thing is, we just had studies just published 3 years ago that cancer cells now can use ketones for energy. So everybody's like, oh, go to ketogenic diet, starve your cancer out. Now we know that the cancer cells grow 2.5 times more because they can now consume ketones. And metastasis went up 10 times in the animals. Okay, so we have to be careful. Cancer is a little bit smarter than most people. Okay, it's been around a lot longer than most of us. Okay, it's been around for millennia. So we have to understand it's a metabolic disease. So we have to get good nutrition and not just think that we can biohack our body and get better. Okay, this is what you should be eating: a little bit of grains, a little bit of legumes, a little vegetables, a little fruits. Are grains evil? No. Is glyphosate evil? Yes. Okay, and there's a difference of when people say, oh, wheat belly, grain brain, oh, I have problems with gluten. It's not the gluten itself, it's the glyphosate that's been sprayed on the gluten. If you want to learn more about that, read my book. I have a radio show next week where I'm talking to Dr. Zach Bush, who's an expert in glyphosate toxicity. We'll be talking about how that's been affecting this whole gluten phase. So when you look at these two pictures, and you want to look at when someone's going to say, where do you get your protein? Well, I say, I know where I get my protein from on the right side over here, but where do you get your phytonutrients? Where do you get your fiber? Where do you get your antioxidants? Okay? And then also you'll read my book, which is kind of, for those people who like data, I have about 1,500 references to all the studies and all. But there's a study that was done on the top 8 fast food restaurants, Diagnostic Annals of Pathology, and they found that the animal protein content in fast food, the top 8, is between 2 and 14%. So 86 to 98% of your animal protein patty in a Mickey D's or a King of Burgers is not real meat. What it is, read my book, you'll find out. Food sensitivities. So now we want to look at, when we move people evidence-based, right? So we know that eating plants are better than eating animal proteins. That's simple. Now we want to look at your own individual immune system. Because some people say, I swear, Dr. Pai, when I eat this food, it bothers me. It might. They might actually have a gluten sensitivity. They might have a corn, soy, tomato, bacon, egg. We will check that. Two types of reactions that you can get from a food. One reaction, you can eat a food and within an hour, 1 hour, is called an IgE reaction. It will trigger an inflammatory response of an itis. Heartburn, reflux, gas, bloating, diarrhea, constipation, or any kind of itis in the body will flare within an hour. The second reaction is a delayed. It's a delayed reaction that happens a few hours up to 4 days later. So today being Saturday, you could have had something on Thursday and today have symptoms, or something on Friday, or etc., right? So everything compounds in the body. When we look at this threshold, in my book I write about something called the levee point. Think of Katrina in New Orleans. The water would go up and then it would cross over and then it was a disaster. Every part of your body, every cell has a levee point, a tolerance point of wear and tear. But when it crosses that, then there's a dysfunction of the area. So you can have normal muscles and then all of a sudden you have muscle ache. You can have normal joints and then they're stiff and they ache. You know, oh, I'm super smart, now I have brain fog or senior moments or whatever you want to call it. You know, we can say, oh, I have a lot of energy, now I'm really tired. It's just the stacking and the building of these. So you can eat a lot of one food and cross that threshold, or you can eat a lot of little foods and chronically be in this state. Okay? You'll find out, you know, we can test that. And it's important because then we want to personally individualize what is the most anti-inflammatory diet for you. Because a lot of people try to go plant-based, and they go, hey, you know, I get plant-based, I tried some of this green smoothie, I tried this product, and then they flare. Why? It's because they might have a sensitivity to one of those foods. Right? So then we can further define what foods you shouldn't eat or eat less of. Then you're on a complete anti-inflammatory diet. Then you're preventing most of the chronic common diseases in the United States. Now, some people test, I'll let you know, some people like to test mixing these reactions. That's not valid. So you have to separate them. That's also discussed in my book. Now, for those people who want to understand about detoxification, go talk to Maureen at our booth downstairs. She can talk to you about panchakarma. I explain a little bit about what panchakarma is in my book. Obviously, I don't think I need to talk to anybody here about smoking, hopefully. And even e-cigarettes, people should not be smoking e-cigarettes. There's new data that we put in our book about that. Now, super important, this. Everybody should pay attention to what this on the screen is. This is a black box. So there's something called a black box warning I want to teach about. This is the impetus of what made me write my book and also what made me come up with an anti-inflammatory product called Bosmeric. It's called the black box warning. So what a black box warning is this. On every drug that you take, over the counter or prescribed, can have a warning, okay? Now, sometimes we have what we call a common side effect, and then we have a serious side effect, okay? Common side effects, now let's talk about the anti-inflammatory, the non-steroidal anti-inflammatories. Ibuprofen, which is Motrin and Advil. Say naproxen, which is Aleve, naproxen. Okay, those kind of things. Celebrex, that many people take. Okay, these are all non-steroidal anti-inflammatories. 1 out of 3 people take this every day. Okay, in my book we'll talk about how many billions of prescriptions and how many over-the-counters there are, because there's just tons and tons of generic brands, right? So many Profen products. CVS Profen, Walprofen, you name it, Profen, it's out there. So 1 out of 3 people take this every day. Now what happens is the following. Common side effects are common. So it's going to say you can have heartburn, you can have a little bloating, you can get a headache for treating your headache, you can have swelling of your ankles, you know, ringing in your ears. No one dies from those things, they're just discomforting. Okay? Then there's a serious reaction. The serious reactions, you can have a heart attack, a GI bleed, a stroke, or some other serious issues. But serious reactions occur rarely, and common reactions occur commonly. Now, anytime a serious reaction starts to occur commonly, then you get this, which is called a black box warning. So what the FDA then puts on your insert of your package is a black box warning, is that right now with all non-steroidal anti-inflammatories, ibuprofen, Motrin, Advil, Celebrex, you name them, Aleve, whatever the generic or brand name is that you can have a heart attack, you can have a GI bleed or a stroke at any time just taking one. Heart attack, GI bleed, or stroke at any time just taking one. Now people say, well, I've been taking this for years, I haven't had a problem. Well, now we look back at the data. The #1 cause of death in the United States is no longer heart disease. I mentioned before, it's number 2. Number 2 is heart disease, number 3 is cancer, number 4 is stroke. The #1 cause of death, and all the data is in the book and all the references in the research, is medical errors and side effects of drugs. So more people die from what we are treating them with, and the side effects and the medical errors that we're doing in hospital settings, okay? Just in a hospital setting, I'll just give you an example. 100,000 people will get hospitalized due to NSAIDs and have fatal complications when the ibuprofen product is given as directed under doctor supervision, delivered by a nurse with food in their stomach. 100,000. Okay, so when we think of 9/11, which is a tragedy, we think of these shootings, which are horrible tragedies, but no one's looking at the larger tragedy that's happening every day when we just take something over the counter and pop it in our mouth. Okay. Now, the interesting thing is that when they have a black box warning, that means once you open the package, so if you get an ibuprofen, or you go to even if you go to the gift shop, for example, and you go, oh, I have back pain, I was lifting my boxes and trying to set up my booth, or I've been on my feet all day, and I buy this little package. Once you tear open that package, once you twist off the cap, once you open a bottle, you've accepted the terms and conditions that can happen, and there's no legal liability to the pharmaceutical company. So that's why there's hundreds of generic brands on the market, because you can't sue them. You've been warned, whether you know it or not, it's on the insert. And if you listen tonight to a commercial on television, they will read the whole black box warning on this low monotone voice as everybody's dancing around. Okay, so black box warnings, now not every drug has a black box warning, but when a drug has a black box warning like this non-steroidal anti-inflammatories, all of them, then you gotta be very careful. Because now we see people who go to the hospital, hey, Dr. Pai, my blood pressure's under control, my lipids are under control, but I had a heart attack. What happened? What are you taking? Oh, I'm taking ibuprofen. Oh, twice a day. There you go. So you can be completely healthy and just say, oh, I have back pain, this, that, and I take that. GI bleed. So a lot of people go now to the hospital with a GI bleed. Now we're seeing young women having GI bleeds. I had 6 patients last year, menstrual cramps. They just borrow someone's Midol once, psh, bleed. But they will always say, oh, maybe they were drinking, maybe they were stressed, blah, blah, blah. We all try to find these excuses because we don't want to look at the common thing that we take commonly, okay? That is putting people in the black box. In my book, I'll cover the data because you'll find out that how many people have died in a 10-year period covers more than all the wars, except for World War II. But all the wars combined after that, Spanish-American Civil War, Vietnam, all the wars combined, more people die in 10 years from taking ibuprofen products. Now, facts and fiction. So what we're doing is evidence-based. We want to look at what do we give for patients that is factual, that's based, that's safe, that's natural, that's clinically effective. We have to be really worried about what's on social media recently, because everything is going to say, this works, and I watched this video, and this person said this about, how do I treat my cancer, or how do I fix my disease? We have to always look at evidence-based, and what I mean by that is that I apply the critique just as much as I look at a chemotherapy drug to a natural product. We have to look at what's the safety, what's the efficacy, what's the potency. A lot of patients will go and buy a good product category, but what they're actually being delivered is subpar. Okay, so I'll give you an example. This is a product we call Bosmeric. This is what's put me on the map. We've treated thousands of patients worldwide with it. It's an anti-inflammatory. It took me 6 years to help develop in the pharmaceutical manufacturing. It's got 65 human clinical trials just on the curcumin C3 complex component of the product. Now, what we look at is, like, a lot of people have heard of turmeric before. Almost everybody in the audience has probably taken a turmeric product. Now, a lot of people are like, it kind of worked, but not really so much. Why is that? It's because when we look at drugs, when you get a brand name of a drug and you get a generic, is the same, okay? So if you get an Advil or Motrin, which is a brand name, that molecule is ibuprofen. That's the same. That's why we like to buy generics, because we don't want to pay for a high price for just a name of a product if we don't have to. But when it comes to natural products, we cannot patent natural products. You can grow green tea in your yard. You can grow blueberries in your backyard. You can grow tomatoes in your backyard. What we can patent, though, is how those compounds are extracted or how it's processed. And there's differences then in efficacy, and that's why there's patents on them. So on curcumin, for example, curcumin is 5% of turmeric. When curcumin is given, what happens is that we extract 3 specific curcuminoids at a specific ratio. Now, everybody in the industry for 15 years said, well, we'll just put 95% curcuminoids in our product. And you see probably every product, it's 95% curcuminoids. Well, we've known that's not going to work because it's the ratio of how it's extracted. And last year, they published in vitro and in vivo studies. That means in animals and human studies, right? And cell cultures as well. We looked at the top 5 95% curcuminoid products on the market, including ours. And we looked at efficacy in terms of inflammation and immune system function. And guess what? All the other 95% curcuminoids had very little to no anti-inflammatory effect. These are all major brands. Yarrow brand, Metagenics brand, you name whatever brand at the store. It's because everybody's trying to sell you something that you read the data on the internet and say, I heard it does so many things. There's so many studies on that. But where's that study? What's the material actually they're using in the study? And what is that potency and purity? If you're not getting that, you're not getting the results that you're intending. Okay, the second ingredient is boswellia. Many of you know frankincense, right? Right now it's kind of like the frankincense year last year on social media. I did a video and I started talking about frankincense a lot because frankincense, myrrh, and gold, as you know, is about the baby magi and the story about where frankincense is coming from. So everything's kind of exploded from there. Frankincense is boswellia, and there's 3 fractions that we've taken out, AKBBA, polysol, and a boswellic acids. But essential oils, for example, do not carry the same ingredients. So when people say, oh, essential oils of boswellia, frankincense do this and do this and do this, it doesn't. It does other things, but they can't make the same correlation because the compounds in an essential oil is not the same thing in a gum resin when you take a product, okay? Now, it has a 20-minute onset of action and an 8-hour sustained release. So when you take this, it'll be just like a fast-acting, long-lasting product. A lot of people say, oh, I don't want to take natural products because I take my fast-tab ibuprofen or my fast-tab Tylenol. And most patients and most people don't have the patience to take Chinese medicines, Ayurvedic, oh, it's going to take weeks. So it took us 6 years with the pharmaceutical manufacturing to put it together so that we can get that quick, water-soluble, lipid-soluble, both contents at one time. Ginger, most of you know, is an anti-inflammatory, helps with gastroprotection as well. We put 20% gingerol, it's the highest available worldwide, and the bioprine, which is the black pepper that helps the enhancement and absorption. Now, something called synergy. Why we put these 4 together? Because the 4 together are stronger than just one alone. We used to do high doses of just curcumin. A lot of doctors used to do that. Cancer patients, 8, 12 grams. Now we're looking at studies how we can give the smallest amounts in the right ratios to lower. Now the bosmeric that we know, it can lower 97 different levels of inflammation naturally, okay? Now why we even put it in a bilayered caplet, this is now looking at science, because a lot of people will say, hey, I got a capsule product at the store, it's got some turmeric, it's got some boswellia, it's got some nattokinase, bromelain, papain, some other kind of proteolytic enzyme in there. If you put it in a capsule, those ingredients will start to degrade itself. And then it's not as potent as you think it is when you take it. So we bilayered it. We did a lipophilic and a water-soluble fraction so that it is guaranteed potency at the time you take it, whenever you take it, right? So a lot of people are like, oh, I took this product. By the time an average person gets a product from a bottle, it's been about 8 to 10 months in supply. Okay, so the potency of that just is going down and down and down and down. We want to ensure, just like your medicines, that you can take that all the time. Something called Shilajit. This is something new, but we've used this in Ayurvedic medicine for thousands of years. Shilajit is a live resin. And it's important because what Shilajit can do is improve cell function. It's a mineral pitch. It's like a tar. I'm talking about 3 things today. Aside of the diet, these are 3 basic simple things. Like we all know about vitamin D is very important for your immune system, right? So when we look at Shilajit, Shilajit is something that it's a mineral pitch. We've actually tracked the source. We actually have studies on it. It improves cell response. So when we have patients that are taking lots of medications or lots of supplements, how do you improve their response instead of going up on more doses? Okay, so it's a mineral pitch. They take about a pea size a day. They put it in the water, let it dissolve. Tastes like dirt because it's a mineral pitch, and you drink it every day. After about a month, you'll start seeing your patients, if they have blood pressure problems, are able to lower their blood pressure medicines down because the cells are responding better. It improves tissue repair. It helps bone density. So there's a lot of things we're looking at now as healing aspects. We're not talking about vitamins and minerals and stuff like that. We test for that. People should be getting that from the diet. Now we're looking at how do we enhance your overall health, and Shilajit, or we call it pure black, is one of the best things. Now, immune system functioning. Beta-glucans. This is the year of beta-glucans. Most people have heard of beta-glucans or been taking beta-glucans. Beta-glucans are polysaccharides that come from plants. Okay? Remember, there's no immune factor that comes from an animal protein. So someone says, you got to eat this to help your immune system, and it's coming from something like whey. Whey has the immunoglobulins, but it's still a pro-inflammatory protein. Okay? We're looking at something that comes from plants. So when most of the people here who are doctors of Oriental medicine, they give mushrooms, right? And most people think of maitake and shiitake and turkey tail and all those things. All the mushroom extracts have what they call a beta-glucan. okay? Now what happens is over time, we've been looking at studies looking at which is now the strongest. We all love taking immune supplements. We all take mushroom extracts, and now we can actually grow the beta-glucan, and we can manufacture it off like a probiotic species, okay? Then what we've done is we've done comparative studies. So now that we all take something that's natural for our immune system to keep our immune system strong, now we're looking at which is the strongest. So we do in vivo and vitro testing. So our goal, like when we look at an integrative medicine aspect, is not just recommending, oh, just take something or this is a good category. Now we got to get to the level of detail of like which is going to work in our patients better, because we can't fail them. If your doctor prescribes you a drug, we know that there's a trial, there's a study, it's going to have some kind of efficacy. If we don't do that, then we're failing you, because the rest is just fancy marketing. No fault of the patient. Everybody wants to get better, but the internet and stores are all about margin and retail profits. And we're looking at outcomes of patients, okay? So what happens is if you look at some of these things, and I'll just read it really quickly. Most of you have heard of AHCC. It's a mushroom complex. The beta-glucan is 160 times stronger. It's 64 times stronger than the Now brand, Immune Renew. 32 times stronger than Epicor. 32 times stronger than Mushroom Science. 16 times stronger than Wellimmune. 8 times more than Maitake Gold 404, which most of you hear on the radio all the time, right? And it's 8 times more than PSK Crestin, which is a prescription drug that comes in Japan that costs $900 a month. Because it's now how we manufacture things, those things are patented, and then we run clinical trials. So our goal is that when people take something like this activates the immune system. It does not overstimulate that. And on my radio show, I actually interviewed the scientist and patent owner 2 weeks ago. So if you want to go on this, I have a little paper on your desk there. You can go to voiceamerica.com, and you can learn, because our show will talk about individual scientists, doctors, researchers, and also people who have tried and taken things and have overcome serious conditions. So what people can do is take 2 daily, every day on an empty stomach. After about 2 weeks, it will start activating the immune system. Remember, 80% of your immune system cells are in your gut, so microbiome is everything. What you feed it, what you do to it is very important. Avoiding as much antimicrobials in your diet. And also when people take natural antimicrobials, people take oregano and berberine and uva ursi, you have to be careful. We actually will test the microbiome. We actually will see once someone does antibiotics or chemotherapies, or they take natural antimicrobials over time, it will affect the microbiome. Okay, so your good probiotics are also knocked out. So we have to measure those things and then correlate what can we do to increase that by probiotics and by eating fermented foods, as much fermented foods as you can. Kombucha, sauerkraut, kimchi, all those things are great at fixing the gut. Sugar and salt. Everybody knows about sugar, so I have a whole section in my book. But I'll talk about how sugar is not only addictive, but sugar is pro-inflammatory. Right? So we get stuck on this addiction and pro-inflammatory state. And actually, we have studies now showing just reduction of sugar in school, reducing sugar in even prisons, how much the violent behavior will change. People are more calm, people are more happy, all these other issues. So we can't overstate that. And we will talk in the book, which are the heavily sugared foods. What are the heavily salted foods? And what are the top 10, for example, when you go out to eat at a restaurant, the most common meals that are eaten at the most popular restaurants, which are the ones that have the highest salt content? And one of them, you'll be surprised, which is the number 1, has enough salt for 3 days. And people are like, oh, I'm eating this to lose weight. I'm like, you just gained water weight on your feet, right? Now, meditation and yoga stress reduction, this is key. So again, it's not a pill. This is just as strong as taking an anti-inflammatory, is that we have studies now, we look at how we do certain types of pranayama, breathing techniques, some certain type of asanas and postures. Meditation is preparation to, yoga is getting preparation into meditation, okay? So everybody should be doing some kind of parasympathetic exercise, meaning we're putting the body in that calm, restive state. Right now, everybody wants to just go to the gym, run, and go to stressful work, right? Exercise is a state of physiology. It's not a state of health. Okay, so everybody runs and runs. They still have heart disease. They're not reversing their heart disease. They're not reversing their cholesterol. They do gain muscle mass and strength, but that's a different thing. Okay, so you want to look at how to put the body in parasympathetic state. Okay, this is the relaxation state. And we have studies we'll show in the book where how you can lower the inflammation just by doing meditation, just by doing yoga every day. So these are simple things that people can do at home that's free. We actually teach people. We have a yoga center. We have classes. Because our goal is to empower as many things that you can do at home as home care and not have to worry about going to the doctor all the time. And lastly, we look at coexisting. This is really key in today's day, is how do we live together like we used to? At least I feel like we have to do this. It's important because we have to build community. This is what this conference is about, is building community. It's kind of connecting, although there's different providers from people from different places, that everybody has a different skill. How do we actually share that knowledge with each other? How do we share patients, not hoarding patients, or not shunning patients? It's like, how do we actually improve it? Being a poor state, all we have is each other. Like, we don't have big industry, we don't have really money at all. So the goal is, what we do have is we do have healthcare providers who can help a lot of people. And our goal is, how do we improve our overall state's economy? I think by having courses like this, and also eventually we can bring patients in. Like, I look at the Neuroacupuncture Institute over here, Dr. Jason and Linda Howe, how they're bringing in people, they're training doctors and doctors of oriental medicine on how to do specific techniques that no one does worldwide. This is putting us on the map. So I really want to talk, and emphasize having coexisting in community is key. And that is it right now, so I'll leave it up for some questions. There's a website here. On your table, I actually put an action item list. And I want you to look at that, because those are things that you can do today. I wanted to make these things very simple. The book will cover all the science, all the research, and many more steps. But I also want to make sure that you can go home and say, if you eat 3 more vegetables and fruits a day, you improve your health risk 30%. 6 more, 6, 9, 90%. That's why it's 9 servings of vegetables and fruits a day. That's the simplest thing. Drink filtered water, fresh, clean water, spring water. Look at all these other things like meditating, yoga, and obviously we gave some recommendations on how to take the anti-inflammatory, a little bit of the immune benefits. And then go to voiceamerica.com and sign up for or listen to our show called Take Back Your Health. It's a weekly show. It's free. It's on iTunes. You can watch it on demand or get a Voice America app and download it. We interview people all the time. It's a great resource. We also record it and we post it on Facebook so people can even watch the interviews if they want. Okay? All right. Any questions? Go ahead.
In your talk about the anti-inflammatory over-the-counter substances, you didn't mention aspirin or Tylenol.
Yeah, so I'll answer that. So the aspirin and Tylenol, good question. The question was, what about aspirin and Tylenol being a non-steroidal anti-inflammatory? Yes, they are non-steroidal anti-inflammatories. Actually, aspirin's the worst because more people die. So remember, cardiology used to say aspirin a day, right? And in about 2 years ago, 3 years ago, the new guidelines were the aspirin does not prevent the primary heart attack. So we used to take it to prevent the heart attack. Actually, more people were dying of GI bleeds than preventing the primary heart attack. Now, secondary heart attack, meaning someone actually had an event, it could be helpful. Now, how do we look at science and outcome? So an aspirin has a platelet inhibition effect about 7 to 10 days, meaning when you take a baby 81 milligram enteric-coated, safety-coated aspirin, lasts about 7 days. So what we do is, how do we get that person the benefit, but not have them have the GI bleed, is not take that every day, but not take it more than every 7 days. So that you want to do like maybe every 3rd day, right? So they're getting the benefit and lowering the risk. Tylenol does not have a black box warning, but they did increase the time that in between each dose. So it went from every 4 to 6 hours to every 6 to 8 hours due to hepatotoxicity. The average American is, on average, who takes a lot of over-the-counter products, taking about 3,000 milligrams of Tylenol a day, not knowing it because it's in their AM and PM, their night, their cough formula, their allergy formula, et cetera. So they extended the guidelines because of liver problems. Okay? What about lectins? Dr. Gundry's work. Okay? So bunk. It's all bunked. We debunked it. It's on the line. Cornell University of Nutrition gave a whole guideline of that. One thing you have to be careful of, what happens in the book, media, and diet industry, is that we always have a surgeon of some kind, right? And all of a sudden the story will be like this. I've done 10,000 surgeries, and somehow when I was in the OR, all these years doing surgery, the story will go like, I came up with something that no one else has come out who's been studying and researching in the field for decades worldwide, okay? And it's been debunked. Lectins do not have a problem. What you have to look at is, what are the pro-inflammatory foods you're having, okay? Now, if you actually look at his book, if you Google, plant paradox, there's actually, it's the 4th one down. Cornell has gone through all that, and they've debunked each thing because there's no study that has a problem with lectins. And in fact, in his book, it's only a poster presentation that talks about it, and all the research, the word lectin is not even in the research. Okay, so that's just a little bit of, again, it's moving people towards a little bit more of a paleo, a little bit of a ketogenic, a little bit more Mediterranean. Everybody still wants to sell some kind of animal protein.
Do you know anybody that's compounding intravenous boswellia?
No, I don't know anybody. But here's a very, very careful thing you need to understand. The microbiome is important on how all these things are triggering the body. So let's take curcumin. Since we've done 65 human clinical trials with curcumin C3 complex, it's been published in Mayo Clinic, MD Anderson, all the big hospitals and stuff. When we look at taking that curcumin, because we've been working on this for 15 years in the animal studies, we were looking at how we can deliver as a drug curcumin IV, right? And when we gave it to the dogs, it lysed all their red blood cells. They all died. Okay? Why? Because these are super powerful compounds. And now we're putting this, instead of going through your gut, going through the digestive process, what we now understand is like when curcuminoids are not really found in the blood that very well, it's because it doesn't have to be in the blood very well. What happens is when we eat these foods, all the foods that you eat, it stimulates a cascade of effects. And that's what's upregulating, downregulating, and turning on. It's not that that molecule is just floating around like we thought. So last year, there was a patient in California who had eczema, went to a provider in California for eczema, and they said, oh, let me give IV curcumin, and she died in the clinic. Yeah. Now, because so remember, we have to be really, this is my little soapbox, but we have to be really careful about IV therapies. Because a lot of people think like, oh, I can just take IV vitamin C and do this. I can take my little bag of, whatever, Myers cocktail. You're bypassing the microbiome and you're bypassing the nutrient effect. And those vitamins and minerals and compounds, even plant compounds, are different when we give it IV than we take it internally. Even vitamin C, like all the studies with cancer, because it's a big thing. Everybody wants to take cancer and vitamin C. There's no study still published that shows that vitamin C has an anti-cancer benefit. It helps with inflammation, it helps with people with quality of life with cancer, but it doesn't have an anti-tumor effect directly. So a lot of people think it's the natural chemotherapy. It's not, okay? So we gotta be careful of like, now even when you look at the studies on when they did, is that people were taking it orally. So nothing's been shown more powerful than eating those things or taking those compounds whole, because how that, this cascade is where the science is now moving, because it's the microbiome that's making those things more effective or less effective.
One more question.
Are there evidence-based studies with CBD for inflammation?
There is data published on CBD on inflammation, but they're animal models. We are actually running trial right now through University of Natural Medicine in Portland. They're a medical school there, and they're very progressive, and we're running a trial where we're providing CBD with patients, and they'll be drawing blood parameters and stuff like that. So we'll be doing one of the first groups doing that nationally. Okay, but it is an anti-inflammatory. It does help, and we can have a whole. That's a whole other discussion.
And then can I ask you one more really fast?
Sure.
About proteolytic enzymes.
Love them.
Okay, and can you share with us how you generally use them?
So proteolytic enzymes, we love it. That's different than digestive enzymes, right? We use it extensively in what they've been using it in Europe, but more here what we use it is post-trauma surgery. So anytime there's swelling, it helps break down that tissue swelling. So like knee surgery, back surgery, any kind of hip surgery, we love that. Chronic pain problems, we love that. Cancer patients, we love that because it also helps break down sometimes the proteins around the cancer cells, so the therapies that they give, whether it's chemotherapy or natural therapy, work better. They always have to be taken on an empty stomach.
Is there a peptide or a combination?
The combination, but that's one of them that's good, yes. All right, thank you.